All right, awesome. Hello again, everybody. It's great to see you out there. Thank you so much for taking time out of your busy lives to be here this evening. Super pumped, super excited to be sharing this information with you. This series is one of the most popular series that we do here, the webinar. It's called Adult Onset F.A.S. So I did hit the record button, so it's good. If you're at home and you have access to a notebook and can take notes, awesome. If you're driving, that's okay. Just listen in. This will be recorded, and we will post the replay links afterwards so you can rewatch it, get more information from it. And remember, repetition is the mother of skill, right? Hearing it over and over and over is only going to help you and benefit you. And plus, if there's somebody here that as I'm speaking, that you're thinking of, maybe consider sharing this information with them to see how they can be helped naturally here too. So let me go ahead. We're going to share the screen, pull up the PowerPoint here. Okay. There we go. Outstanding. So happy August, August 20th. So we're moving right along through another month. And sometimes it's hard to remember what day of the week it is. So raise your hand if that's you. If you are raising your hand, you know that was a bit of a trick question right there, because we're going to be talking about upper extremity issues, and I just kind of want to see where your arms and your shoulders are at this moment. So welcome to our Adult Onset FAS. We are going to be dividing this into a two-part series. Tonight is going to be on upper extremity problems, and then next week we're going to tackle the lower extremity problems. So mark it on your calendars. Next week, we'll be talking about hips, knees, ankles, feet, the legs. We'll tackle that. But tonight it's about neck, and it's about shoulder pain. It's about shoulder cuff or rotator cuff issues, including tendonitis, bursitis issues, the AC joint. We're going to tackle that. That's where the collarbone and the shoulder come together. Tennis elbow, golfer's elbow. So we're going to be tackling those points, and then also carpal tunnel and any hand or other wrist issues. And then the itis is here. We got tendonitis, we got bursitis, degenerative processes. Look, we're going to be sharing some really powerful information so that you know that you're doing everything that you can to hit your health and wellness goals. A recent study that came out, it was very interesting, is that in the population over 65, is that the research shows that 87% of people over the age of 65 have some sort of tear in their rotator cuff. So we know that these issues and symptoms that are listed here, that can be very debilitating to your quality of life. Yes, the pain is bad enough, but it can really impact the quality of your life. You can start working around your problem, limiting your life, and then all of a sudden you're not getting the most fulfillment out of life. If I do my job here tonight, we're going to unpack the common causes of all these symptoms, and I'm going to reveal to you what you can be doing, the most effective, the most powerful, and the most natural treatment for each one of these issues right here. So you don't have to work around your problem. You can be living your life to its full. And if that's you and you want that, raise your hand here this evening. So FAS, what does FAS stand for? This is Adult Onset Falling Apart Syndrome. So I brought plenty of duct tape. I have the staple gun. I have glue, whatever it takes to keep you together and keep you enjoying life to the max. Let's face it, modern life is unnaturally stressful. And with all the current world events that have been going on, modern life that is stressful already is even more stressful, and more opportunity for your health to decay and deteriorate and not live your life to the fullest. Tonight is about providing hope and giving you some very powerful information that you can start to implement into your life so you can get the health results that you want here. So raise your hand if you've had any shoulder pain, elbow issues, or wrist problems. If that's you, raise your hand. You know, tonight we're going to be talking about what are the root causes of these issues and what we can be doing. And I want to share a story with you because this was very impactful early on in my career. I've been practicing as a chiropractor now for over 12 years in the Vienna community. Very blessed to be here. We have an awesome team. We serve an awesome community, and you're part of our awesome tribe here at this practice. And I want to tell you a story about Ann. Ann came in to see me. She was in late 40s, early 50s, came in because she was having arm pain, arm tingling. Upon her history, you know, she's a mom of 3, very busy, a mom who's also working. So just a very hectic lifestyle. So as Ann comes in and she's telling me about this issue with her arm, numbness and tingling, we go through and we talk about who she's seen in the past and what has been done. So we go through the list, seeing a medical doctor, you know, seeing physical therapist, acupuncturist, massage therapist, personal trainer. I'm certain they're orthopedist. There were many other professionals before she came into the chiropractic office, referred into our office, that she had seen. And, you know, trying to figure out what and diagnose what the issue is with her arm. And as we're going through a thorough history, finding out what she's done, what's worked to help relieve any symptoms, which wasn't really much at that time, and what she's tried that really didn't help, I asked one simple question. The question I asked was this: did anybody look at your neck? And to my surprise, out of all those other professionals she went to see, they did not look at the neck. So we did an evaluation looking at the neck and her arm and so on and so forth, and we uncovered and unpacked the root cause of her problem. You see, sometimes your shoulder and arm and elbow and wrist pain, even though you experience pain in that area, that isn't the root cause of your problem. You have to go upstream and get the spine and nervous system checked, because the pseudo-armor, which is our spine, houses and protects our spinal cord. And that's what protects those messages being sent from the brain down the spinal cord and out to the shoulder, elbow, wrist, and hand. And if there's any disruption to that flow of information, we can start to have breakdown in that joint. So we started adjusting Ann, and lo and behold, the body's smart, it's intelligent, started to heal. Not only did she start to feel better, but she started to get her life back. She can make it day to day without having the pain that she was having to deal with from working full time, raising 3 children. She was able to get better sleep, have more energy, and get back to the gym and exercising and doing things that made her happy and fulfilled. And so we want to be sharing this information. So if that's you or someone like you, we want to make sure that we can help in the most natural way possible. Because when Ann came to see me, really what she was experiencing was the tip of the iceberg. We call this our body signal program because the symptoms are a body signal. And the question is, are we listening to the body signals? Are we listening to the whispers the body's given us? Or are the screams there? So the symptom is the tip of the iceberg. Typically what we find underneath the water is the root cause of the problem here. So remember, the symptoms are the body signal. It's your way, your body's way of asking for help. My question is, with all the noise and busyness of modern life today, are you listening? Are you listening? Well, tonight we're going to work on listening even better. So I love this continuum right here. I want to share this with you, and I want you to be thinking about where you're at on this continuum. And this is the illness wellness continuum right here. And on the far right-hand side is the high-level wellness. That is the direction we all want to be going. Raise your hand if that's the direction where you want to be going. I'm certain that's the direction you want to be going. That's why you're here this evening. And then on the far side is the premature death, okay? And in the middle is what's called the neutral point. So I want to point out a couple things, because if we go to the symptom box on the left-hand side, that's what Ann was experiencing, that numbness, that tingling in her arm. And typically, unless it's some sort of macro acute trauma, is that the symptom starts way after the underlying problem has begun. You know what I mean by that? That means, like, for instance, we'll just use teeth. So if you have a tooth pain, typically the pain that you're experiencing in the tooth didn't start the day you experienced the pain. Usually there's been some sort of degeneration or decay happening long before we start to experience the symptom. But these symptoms, especially with upper extremity issues and shoulder, elbow, wrist issues, can lead to disabilities, deficiencies, and dysfunction in our quality of life. Quite frankly, it leads to more unhappiness. It robs us of our joy because we're unable to do the things that we want to do. But before the symptoms come signs, and we'll be talking about that. A sign is something that you can measure. Doesn't mean that you'll experience pain at that moment, but it's the predecessor before the symptom. For instance, a sign of a upper extremity issue may be decreased range of motion within your neck. So if you're noticing any decreased range of motion in your neck, loss of movement side to side, that could be a sign of eventually a bigger problem underlying that can impact the shoulder, the elbow, the wrist, and then the hand. Tonight, what is this about? Doctor means teacher. So that's why I'm here, is to help share some information with you to help your life work better for you. This is about awareness, education, and growth towards that high-level wellness. And I'm confident that if you listen to the things that I say and implement them into your life, that over time, you're going to experience health results getting better and better and better. I can't promise that they're going to happen overnight because the underlying root problem doesn't happen overnight. Healing takes time. And if you're willing to commit the time and do the work, you're going to get the results here. Symptoms let us know what direction we're headed in. So let's talk about the shoulder here. Let's teach you about what's an open kinetic chain here. Your shoulder and your arm is an open kinetic chain. That means that your hand and the arm is not anchored to anything. I guess if you were doing handstands or handstand push-up, you would now have a closed kinetic chain, but this is really an open kinetic chain. So some of the principles of an open kinetic chain would be is that you're going to have more mobility with your shoulder joint. It's going to be able to move in a lot of directions. So there's a big ball that fits in a small socket. I've heard it referenced as if you kind of take the analogy would be as a golf ball and put it on the cup of a tea. And so that small cup is like the socket for that big ball of the shoulder to fit in. It's about that ratio. So you can see how there's a lot of mobility, but it could lead to less stability, which means that it's more susceptible to injury, which could lead to dysfunction. And we're going to get into how modern life has a big impact on this. But that's the open kinetic chain. The benefit is more mobility, but at the end of the day, there's less stability. So we'll go through a few things towards the end of this presentation of what to do to not only have the mobility, but make the shoulder joint and the elbow and then the wrist more stable so that you can be doing the things that you want to be doing. So let's talk about the upper extremity here. The upper extremity is really made of your shoulder. So you have your shoulder blade, you have your clavicle. So what I want you to do is just take your hand and feel that bone, that thin bone that goes from your sternum out to your shoulder. That's your clavicle. Reach around on the back side right there. That's your shoulder blade. Right where your collarbone and your shoulder meet, that's called your AC joint right there. And then your glenohumeral joint is the ball and socket. Then you have your elbow, you have your wrist, and then of course you have your hand. So the picture in front of you, the image is your skeleton. And on top of your skeleton, your nerves sit. And then around your nerves are all your muscle. And then we're covered with our beautiful skin. Of course, I've oversimplified everything I just said right there, but you get the picture here. Let's talk about the nerve supply to the upper extremity. And I want to introduce a term to you called the brachial plexus. Anytime we say the word plexus in the body, it means that there's a network. In this case, there's a network of nerves. And when it's a network of nerves that come off of the C5 to T1. C stands for cervical, that's another name for your neck, and T is your thoracic. Sometimes you might hear it referenced as dorsal, but T is for thoracic. So C5 to T1. What you notice is from the C5 to the T1, this network of groups is known as the brachial plexus. That comes off the spine and in between those bones, and it forms a bundle that is your main power supply and information channel that goes all the way down to your hand. And through different crevices and tunnels and so on and so forth, those nerves innervate and control the function of your upper extremity right there. It controls the neck, the shoulder, the upper arm, the forearm, the hands, and the fingers. And if there's any interference or lack of communication from the brain to the neck and out into the shoulder, it's going to lead to problems there. Also, I want to kind of go a macro view and just kind of show you this right here. This is a vertebral segment, and you have your bones. The white material here is called your disc that sits in between the bones, and that's the spacer. That spacer allows for ample room for that nerve to exit the nerve hole so that nerve can go and control not only the muscles of the upper extremity, but it also impacts organs too. And over time, we're going to talk about a condition, if that disc starts to decrease, if these bones become misaligned, it can start to interfere with that communication there. And your spine is super durable, and it's called the suit of armor, and we call it the suit of armor for a reason. But I do want to let you know it's susceptible to injury, and we'll talk about that in just a moment. And the injuries that can occur, number one, the source could be a macro trauma. So the macro traumas could be, what could they be? What do you think? How about car accident? It could be a slip and fall. How about a sports-related injury? Those are the typical macro traumas. Now, typically for the upper extremity, this only accounts for about 2 to 5% of the actual issues that go on with the upper extremity. It's also important to know that injuries that you have even years ago, decades ago, can start to haunt you today if those injuries were never addressed or appropriately fixed. Meaning that you could have a car accident 5, 10, 20 years ago that has actually led to your shoulder, elbow, wrist, arm pain, hand pain that you're experiencing today. That's why it's important to get checked by your wellness chiropractor to find out what the root cause of the problem is and see if it's a subluxation. If it's a subluxation, that's something that we can help with. But more likely the cause of your upper extremity issues these days are what we call our micro traumas. And raise your hand if you own one of these, okay? I think 99.9% of the population owns a smartphone. Would you agree with that? I mean, anywhere you go these days. Now, I know COVID's kind of changed social gatherings, but if you think about it, there's many opportunities that we go today and we just see people what? They're glued to their phone and they're like this. Usually the arms are in, the head is forward, the shoulders are rolled in, so on and so forth. Or we're at a computer screen or laptop, so on and so forth. Truth is that COVID's changing the world in a lot of ways. One thing that I've noticed is that posture's become more of an issue for people. Maybe you're on a laptop, sitting at home, trying to do your work on the couch, and you have kids that you're trying to take care of at the same time. Many people have been telling me more posture-related issues. So the micro traumas, it's the habituated patterns over time that start to lead to big problems down the road. And these stressors are daily habits. And I want you just to, be thinking about, today, how much have you actually sat today? Was it hours? How long had you been sitting today? And just think about, what is that? Is that like that every day? Is that like that weekly? Has it been like that for monthly, so on and so forth? But any of these images here, these are the micro traumas that we're talking about. It could, and it's not only just in the neck, but also it's with the shoulder position, the elbow, and then the wrist and the hands. Sometimes we're holding our phone with, one hand, we're playing these games, or we're scrolling through Instagram, Facebook. we're typing with our fingers, we're on iPads, or we're, doing a lot of typing on a laptop or a keyboard there. Those are the micro traumas that can lead to big problems here with the upper extremity. And so ideally within the neck, what we should experience and what we should have is we should have a nice forward curve in the neck. And we do objective testing in the office to find out exactly where this is, but we should have a forward curve. X-ray is usually our image that we check to see the curve in the neck. Should have a forward curve. Your ears should be over your shoulder here, and there should be good spacing in between the bones. The bones should be nice and square, and the disc, big spaces there for those nerves to exit. But over time, what starts to happen is between macro traumas and more likely micro traumas, is then it starts the phase 1 of spinal decay starts to cause the neck to straighten out. So I don't know if anybody here lifts weights or you have bowled in the past, but I want you to picture a 10-pound dumbbell and or a 10-pound bowling ball, and think about that as the weight of the head. See, what happens is that weight starts to get shifted forward, and what will end up happening is it starts to put extra stress and strain into the neck. Now, this has a big impact to the muscles, the tendons, the ligaments, the discs, the bones, the joints, and eventually the nerves. And if this goes on long enough, it leads to a condition called vertebral subluxation. A subluxation is a misaligned bone that starts to interfere with the nerves that's exiting in between the bones and starts to cause changes. Now, one of the things that I want you to be aware of, these changes can start to happen even when you are asymptomatic. You do not have to have symptoms to have a subluxation going on. Does anybody know when the first subluxation could occur? What age? Well, if you're out there thinking birth, you're exactly right. 8 out of 10 children are born with misalignments in their neck. That's why we recommend getting the children checked after they're born and even through childhood to look for vertebral subluxations, because these things can happen even when you're not symptomatic. But it's important for us to keep this area of the spine nice and healthy, because this is what supplies the main nerves that go to your upper extremity that can influence and impact the function of your shoulder, elbow, wrist, and then hand. So when we start to see there's certain effects of the subluxation as it goes on for time, over time, but ultimately this nerve interference can affect your body's innate ability to heal and remain healthy. So if there's even the weight of a dime of pressure on the nerve, it can reduce nerve flow by up to 60%. And you can see on the image on the left of how that disc is compressed. It's reddish, meaning that it's inflamed. It starts to push back on that nerve. And that nerve not only goes to your neck, but it goes to your shoulder, it goes to your upper arm, your forearm, your elbow, your whole arm, wrist, and then fingertips. But not only does that nerve travel there, it also goes to specific organs in the body. We'll get in that in just a moment. Now, the X-ray to the right that you see, that imaging, you can see that the ears are not aligned over the shoulder. The head is forward. You can see that there's some good spacing with the discs. See how that dark spacer in between the bones seems nice and big in multiple areas of the spine? This is where I want to point out that this is not just an age-related issue, because you can have select areas of the spine wearing out faster than other areas, yet they're the same age. Well, why is that? That could be because the specific stress to that vertebral segment because of some sort of macro trauma, or it could be that certain areas of your spine are more susceptible to actually wearing out and degenerating faster than other areas. For example, let's go back to the dental analogy that we used. Isn't it true? I don't know if anybody here has had any cavities, okay? But isn't it true that there's certain teeth that seem to be more prone or susceptible to cavities first? You know, if we look at the front teeth or we look at the back teeth, Which ones are going to be more prone to cavities? That's right. It's the molars. It's the back ones seem to be more prone to getting the cavities first. Well, specifically within your neck, what's more prone to wearing out is going to be the C5 and C6, C6 and C7 area. That is more likely to wear out faster than the other parts of your neck and upper back. But do you remember what areas and what nerve roots the brachial plexus went from? If you said C5 to T1, you are exactly right. Those are the nerves that are going to be the most impacted. That is the area of the suit of armor, your spine, most likely to wear out the fastest and have the most degeneration and most impact on those nerves. So what happens here with the subluxation is there's a joint misalignment. The soft tissue becomes damaged. That would be the ligaments, the tendons, the bone, and the disc. Then you have the inflammatory response, which, by the way, I want to let you know, inflammation is a healthy thing within the short period of time, 7-10 days. But when it becomes months, when it becomes weeks, months and years and decades, that's where it becomes more problematic. That inflammation can lead to more chronic health issues and more breakdown within the joints and the nervous system. Nerve irritation as a result. You get muscle spasm because your nerves direct the communication to the muscles. When there's nerve interference, those movers, the muscles that move the joint, start to lock down the joint because it's perceiving a problem and it does not want to further injure or damage the joint itself. Then lost imbibition. Imbibition is the ability of nutrients to get into the joint. Joint becomes fixated, stuck, it's not moving properly, which leads to arthritis and degeneration. A little word on arthritis. Arthritis is an overused term out there. Pretty much if you have joint pain, oh, you got arthritis. Oh, you got arthritis. You got arthritis. And usually there's a pill, potion, powder, or lotion to help mask the symptoms of arthritis. But what do you think will happen to that joint if you don't get to the root cause of the problem and you're only masking it? That's right. Eventually that you might feel better, but eventually that problem underneath is going to get worse. It's going to cause more dysfunction and more degeneration. So the sooner that you get checked, the sooner that we get on a plan to work on fixing the underlying root cause of the problem, and you start making modifications in your lifestyle to sync with your care, the faster the healing and the faster you can get back to having your optimal quality of life. So these issues are the neck, the shoulder, the arm, elbow, the wrist, the hand, any of these areas that are lit in red, which also includes the spot right between the shoulder blades. We include that in here because not only do those muscles from your shoulder blades attach to that part of the spine, but also the muscles of the neck go all the way down to there too. So when you're on your phone, so on and so forth, it can be stressing and straining those areas of the spine. So, I can make an argument that, the most common reason that people come in to see us, it's going to be low back pain, it's going to be neck pain, it's going to be headaches. But right up there, this is a close third, right into the top 3, it's going to be shoulder issues. This could present as shoulder cuff pain issue. You may know it as a rotator cuff issue. There's 4 muscles of the rotator cuff. And if any one of them are not working properly, it'll cause an imbalance within the shoulder. It could lead to tendinitis. It could lead to bursitis. It could lead to frozen shoulder or thoracic outlet syndrome. Let's talk about the rotator cuff. A lot of times with modern life and we're sitting too much and we're not getting the exercise that we need, these muscles start to become deconditioned. They start to atrophy. And with repetitive stress, whether you're on the mouse a lot, you're typing on the keyboard, just these repetitive, habituated habits can start to cause a breakdown in the joint, lead to dysfunction, lead to inflammation, which will ultimately lead to pain. Think about when you have more pain in your body, there's more inflammation. And when we decrease the inflammation in the body, you experience less pain. So that's a body signal, the pain. And then it leads to instability, where you feel like you can't raise your hand up, you can't reach out, you can't hold things of weight into your hand, so on and so forth right there. Bursitis specifically, bursitis, the bursa is, think about a cushion. That's a cushion between a bone and then a tendon. And basically it allows the tendon to glide with the bone, and it cushions between bones compressing on the tendon. The most common one is the supraspinatus. That's the one is if you're lifting your arm away from your body. It goes at the top of your shoulder blade, it goes underneath that AC joint, and it goes right into the upper arm right there. So if you're bringing your arm out or away from the body, if you're experiencing any pain, it's likely bursitis is involved. This has a lot to do with your posture. We talk about this every single day, but when your shoulders are rolling in, it starts to put more pressure on the joint and the tendon, which inflames that bursitis. The overuse syndrome, this could be small repetitive movements when you're at the computer for so much throughout the day and a lot of sitting, or just postural wise, cell phone use, things like that. But it also could be as playing sports, especially the one-sided sports. Again, it's inflammation, it's an inflammatory process, there's swelling going on. And if you take a small space and you add more fluid to it, it's going to lead to compression on the nerve and then the tendons and then the joint itself. It's going to cause pain. Your body's going to give you that signal to say, hey, there's a problem here, we need to do something about it. And you're going to lose range of motion and mobility with that. Thoracic outlet syndrome, the TOS. Think about to the brachial plexus as those 5 nerve root bundles are coming off of the neck, underneath the clavicle, down your arm. Basically that outlet, this can be because the muscles and nerves get overstretched here. A macro trauma, I forgot to mention macro trauma, this specific one would be the birth process. The birth process is a macro trauma for the baby. How many people here were born? Okay, should see all the hands going up on that one. But macro trauma there, think about car accident, whiplash injury, think about some sort of sports injury, concussion, so some sort of macro trauma there, a major fall on the shoulder, fall during sports. Postural stress would be a big one, head forward, shoulders rolled in. It really starts to clamp down on that opening. Think of I-66 right now. I-66, 4 lanes are doing construction. What happens with the traffic here in the DC metro area if you take 4 lanes of traffic down to 3, or you take it down to 2 or down to 1? We all know what happens. There's a major subluxation on the traffic patterns. That actually leads to more stress for your upper extremities. You know, that's when you start to feel your shoulders at the bottom of your earlobes. Improper lifting, lifting boxes, even lifting light stuff. Going to the grocery store, you know, trying to carry so many bags in one arm, so on and so forth. All this, you're moving, you know, you're doing projects around the house now, you're lifting things, you're moving things. Improper lifting can lead to issues here, which impinge the nerves. It causes inflammation, which can lead to pain, numbness, and tingling right here. So think about if you're sleeping at night and you get pain, numbness, and tingling in your arm, it may be because of thoracic outlet syndrome. It can affect all the way the neck, the shoulder, all the way down to the fingertips there. Here's some examples of what can cause thoracic outlet syndrome right here. As I mentioned, carrying the grocery bags so much on one side. Basically, the load and demand that you put on the body exceeds what the body can handle. And then you take a look at backpack stress. Maybe that's not as relevant. I'm not sure with so many of the kids, you know, distance learning, online learning right now. Probably posture is going to be a bigger one for them since they'll be glued to a laptop or computer throughout the day. But backpack stressors, backpacks put children in the ER 10,000 times throughout the year. So you can see what happens when you put excessive weight on the body. Look what's happening to this poor girl's spine. She obviously needs to come in and get her spine and nervous system checked. But what'll happen is your body will compensate and create underlying issues here, interfering with the communication of your nerve to specific body parts there. This is the big purse syndrome. Just had a mom in here today. She said, Doc, I do not dare bring my purse or bag in here that I usually carry around with my 3 kids because I know you're going to say something. So I opted for the lighter. But this is what happens. This is what happens to our posture as we compensate at carrying a bag on one shoulder. It could be a laptop in that bag, so on and so forth. Everything that you need to carry there, and even the MERSes here today. So the man purses. Raise your hand. Any of the men out there carry the MERS? Don't be shy there. But we have the MERS becoming more and more popular. But any of this can create postural imbalances, which start to impact the function of the spine, which ultimately lead to upper extremity issues here. Shoulder problems in our office. During the evaluation, we're going to be honing in on C5 to C7, but then also we're going to be taking a look at T1 to T4. In addition to the shoulder, as I mentioned, is there any part of your nervous system that does not have a nerve supply? Well, of course not. Every cell, tissue, organ in your body has a nerve supply. And so these nerves that we're talking about for upper extremity issues also supply organs. Those organs or organ systems that can be affected would be your sinuses, that would be more of the C5 region, your thyroid. C5 also goes to your thyroid, but also your heart and then your lungs. Is it important to have optimal heart and lung and immune system function these days? Absolutely, okay? So these nerves not only go to the upper extremity, but they also have innervations to those organs in the spine too. The next thing right here that we're going to talk about, we're going to move from the shoulder, and now we're going to move into the elbow. So what I want you to do is bend the elbow, and then I want you to feel that hard bone. Be careful of hitting that funny bone nerve, but I'm talking about the hard bone right there. That's called the olecranon process, and that olecranon process has a bursa associated to it. I don't know if you've ever seen this before, if you've experienced it, but I've seen patients present where it literally looks like they have a golf ball at the bottom of their elbow. That's because the bursa gets irritated. So it could be, pressure throughout the day, postural stress, your elbow on a chair, the arm of a chair, repetitive motion, your workout, things like that, that could really get that area all inflamed. But additionally, more commonly would be the tennis elbow and the golfer's elbow. Here's one myth that I want to share with you. You can get tennis elbow without playing tennis. I just want to be clear on that. It's common in tennis players, but you can get it even if you don't play tennis and even if you don't play golf. Specifically, the tennis elbow is going to be on the outside of the elbow, the extensors right through here. So if you bend your wrist backwards and you feel those muscles contract, that's the area of the tennis elbow. And then on the flip side, on the inside, if you flex your fist forward, you can feel those muscles tighten up. That one's called golfer's elbow. There's a lot of nerves that pass through those muscles there. And if there's a subluxation or misalignment, it can not only cause neuritis or inflammation of the nerve, but it also can affect the way the soft tissues are responding around that area. Namely, as if you have any muscle spasms or muscle tightness, when there's irritation of the nerve, it affects that also. So specifically, tennis elbow, the technical term is lateral epicondylitis. It's tendinitis of the extensors. That means that the insertion point of these muscles into the elbow gets inflamed, and it's typically overuse, straining. So it could be a lot of mouse work. It could be the touch pad on the laptop. It could be if you're working on projects around the house, using a screwdriver, any of this repetitive motion. It's typically because it's overuse, strain. It leads to inflammation. It leads to pain itself. Interestingly, I don't know if anybody's tried any of those elbow wraps or braces. You put a strap right around the elbow to try to alleviate the pain. Interesting thing about that, I looked it up. What's the function of that? And basically what it's trying to do is change the pivot point of these muscles here and the way that they're working. It doesn't address the underlying issue of the tennis elbow. So that problem can continue to get worse. And typically what ends up happening with using that wrap or that strap there, it ends up creating a secondary problem. So we want to be careful of that, make sure we address the underlying issue here. Golfer's elbow, it's on the inside of the elbow here. And again, this is overuse and strain, tendonitis. The tendons get overused, they get strained, get inflammation, and it results in the pain. So we want to make sure that we're addressing the underlying root issue of the problem and that we're not just managing the symptoms. Because if we're only managing the symptoms, you could be feeling better, but not healing the underlying root issue. Typically here with the elbow problems, we're addressing C5 and T1. One of the cool things, if you're already a client here at Pure Chiropractic, or if you're new to us, one of the cool things about our technique that we utilize here at Pure Chiropractic is that we're full spine adjusting. So we're looking at the spine and the alignment to impact nerve system flow, but we're also making sure that shoulders, collarbone, elbows, wrists, hands are staying in optimal alignment to support your spinal adjustments there. Now moving into wrist problems there, this could be really debilitating also, especially carpal tunnel. But I have to say is that unfortunately, it's also misdiagnosed quite often. We have wrist pain and we think that it's diagnosed as carpal tunnel because there's a narrowing of the tunnel where the carpal nerve passes through. So we cut the ligament and we free that space right through there. But a lot of times the carpal tunnel is another manifestation of a neck or cervical issue that went undiagnosed. And I've seen clients time and time again come in, they've had carpal tunnel syndrome. It may have helped with a little bit of symptomatic relief, but it always comes back. And not until we address the root cause will we fix the wrist issue in and of itself. And that happens with sciatica. We'll talk about that next Thursday when we talk about lower extremity issues. But the reality is that a lot of these issues are misdiagnosed. And if they're misdiagnosed, then the proper treatment is not applied and so on and so forth. And we're not getting the results that we desire. But these wrist problems can lead to pain, but it also things like numbness and tingling. This issue can really impact your work, your quality of life day to day. If anybody is using their hands day to day and has ever suffered from carpal tunnel or any of the pain, numbness, and tingling or weakness in the hands, you really understand how it impacts the quality of life there. So we want to make sure that we get to the root cause of the problem here and address that. And so a little bit of the anatomy here is that you have your carpal ligament and the median nerve that goes under the carpal ligament, and it's the median nerve that gets impinged right there. And so that you can see where that yellow, those lines lead to different parts of the hand, and you can start to see where you could experience that numbness and tingling associated with it. The wrist is also a very unique joint because there's 8 different bones within the wrist joint, and any one of those bones can get out of alignment. So we have great success with issues like this with our clients that come in, and we can help with this in a lot of ways, but often related to, it's typically carpal tunnel is not a wrist issue, it's typically a neck issue. And where's this all coming from? It's coming from sitting is the new smoking. And we've talked about this, but 18 studies over the last 16 years have talked about the negative consequences to our health from sitting excessively. So again, I want you to be thinking about how many hours did you sit today? How many hours do you typically sit per week? How many hours is that happening? Then multiply it by the weeks in the month and the year. And typically we start to see this is a chronic long-term issue that has been building over time right here. And as we like to say is that if sitting is the new smoking, screens are the new crack. Our eyes and our brains are addicted to these things. So I want you to, it doesn't mean that we're going to get rid of the technology 100%. That's not realistic, but I want us to have good habits around the technology and also be thinking about the family members. Think about the family members that you're thinking of as I go through all these symptoms that need to get their spine and nervous system checked. Think about your children. No child today should ever experience phase 1 spinal degeneration and decay. We should be able to get ahead of this and prevent future problems for our kids. So if you have some kiddos at home that you want to get checked, we're happy to do so. Parents typically have a lot of concerns about the kiddos and their posture, especially with how we're returning to school this year and the technology. Just that sitting is the new smoking. It leads to a condition called tech neck, and this tech neck can be very debilitating. start to impact the nerves that come off the spine in the neck that go right to your shoulder, your arm, your elbow, your wrist, can really start to impact your quality of life. Because what ends up happening mechanically is, remember we said, take that 10-pound or 12-pound dumbbell or bowling ball. And if I were to ask you to take that and hold it with your arm directly over your head, let's say the 10-pound dumbbell, which easier for you? To hold your arm directly up over your head or to hold it out in this direction? You tell me, what's easier, overhead or forward? Well, obviously it's going to be holding it up above your head right here. But we live most of our life with our head forward like this. It puts excessive strain on our neck, and that leads to a lot of pain, dysfunction, and problems in our upper extremity. And the impact is, I cannot overstate this, but the impact is a decreased quality of life. People start to accept pain as their lifestyle, and they start living around their problem. They give up on their dreams and their goals and their desires of what they want in life, and succumb to the fact of saying, you know what, I'm just falling apart. This is a normal part of the aging process. And then they resign to the fact. We're about here seeing what we can do, everything that we can do to help you lead to better health outcomes and get you doing the things that you want to be doing, and also to be helping to restore some of those activities you want to do, and also keep you doing the things that you want to be doing around the house, the yard, other hobbies, exercise, things like that. So our upper extremity issues usually start into the neck. This is why you don't want to chase symptoms. Chasing symptoms out there can address, maybe at best, the symptom, but not address the underlying root cause. You want to identify what the root cause is, address the root cause, not only so you fix the underlying root cause and it doesn't get better, but you fix the underlying root cause to keep you healthy and keep you going strong. So specifically here, with the wrist problems are typically the lower cervical area at C4 to C7, the area right above the traps. Those are the main nerves that go right to the wrist. So here's our simple 3-step protocol here we have in the office, what we teach our clients to get the best results in the practice. Number 1, break the bad habits. This is a done with you program, not a done for you. I wish I had a magic wand. I know many of you that come into the office that are already clients here at Pure Chiropractic do think that we have a magic wand here. When you get adjusted, you feel amazing, you're functioning better. And yes, we do have a magic wand here, but we need your help in this. We need your help in helping the adjustments hold better, and we need your help in preventing the subluxations from returning. This is about breaking bad habits, becoming aware of this. Remember, high-level wellness, it's about awareness. And so some of the bad habits would be around poor posture, poor eating habits. We cannot discount the nutrition and the fuel you're putting in your body, because the wrong fuel will lead to more inflammation. Bad habits when it comes to sleep, specifically my stomach sleepers out there, sleeping on your stomach with your head and neck turned 8 hours a night puts a lot of stress and strain on the neck. Your workstations, poor ergonomics, phone habits, those are the micro traumas that I'm talking about that we need to have better habits around. And cool thing is, remember, health and wellness is about progress, not perfection here. And so the second thing that we want to focus on is to add specific exercises. We want to be adding specific exercises to strengthen the weak muscles and tendons around the spine so that you hold better posture and hold your adjustments better in between the visits. Look, here's the deal, is that exercise is considered essential nutrient. You cannot go through life and expect to be as healthy as possible and not move. A sedentary lifestyle is one of the fastest ways to lead to deterioration, decay, degeneration, and poor health. And this is really big when it comes to our kids and our teens these days here. So I want to teach you a few things here before we end this webinar tonight to add some value into your life. So this is how we're going to bulletproof the lower shoulder. It's a little bit hard for me to demonstrate all this with our current setup, so I'll talk you through some of it. If you have questions later, you can circle back around at your next chiropractic appointment. Or if it's been a while since we've seen you, or you're new to this practice, let's schedule a special consultation to talk about this and about what's going on and how we can help you achieve your health and wellness goals here. But the push-up plus. So this would be doing a standard push-up here, and then also at the end, retracting your shoulder blades. Okay, pulling them out just like that. Retracting and then moving those shoulder blades. It works really good for the subscapularis muscle, among other muscles. That's your one of your rotator cuff muscles. The next one, hey, if you're able to, let's do this right now. How about the wall angel? This one's going to be a little bit easier to demonstrate. But if you can find yourself a flat wall, you can even do this on the floor. And what I want you to do is I want you to get your elbows and your wrists against the floor of the wall. Now, if you're up against the wall, you can move your feet like 3 to 4 inches in front of you. And that way you can flatten your back and then get your elbow and wrist. For some of you, I want to let you know this is going to be impossible for you to do at the moment where your body is at this particular time. And that's okay. We all have to get a starting point. Maybe your win is you're just able to get the shoulders back to the wall. Then the next part there is then to get the wrists against the wall. Then once we get there, as we're against the wall, we're basically going to use the wall as a glide to allow your elbows and arms to come up over your head and then back down just like this, back down and forth like that. So that's the wall angel right there. Very powerful exercise to help with the mobility of the shoulders. I read a great book. It's by a physical therapist called Pete Egoscue. It's called Pain Free. And I like the way he demonstrates this. Our modern life is basically we live in a box. If you think about it, our computer, our cell phone, the stapler, the phones, the paper, our laptop, everything is in a box in front of us. Rarely, unless we're consciously doing this, we're extending our arms up over our head. This can lead to a lot of postural stress and dysfunction within the shoulders because we're not using them properly. And the last one here, the reach, the roll, the lift, combining these 3 specific exercises here really opens up the neck, the scapula and shoulder, and then the thoracic area to help you there. So there's a couple ideas right through there. And if you would like, I have a series of shoulder exercises. Raise your hand and maybe in the chat box, just type me in there, M-E. And what we can do is I will specifically email you the list with instructions of these shoulder exercises here so you can have them and you can start working on these shoulder exercises and then give us feedback on how these are adding value to your life. They're super awesome. These come from a chiropractor who works with high-level athletes, specifically in the world of Major League Baseball. And he has his pitchers and these high-paid professional athletes do these movements. And I want you to be clear that it's not about lifting weights. It's not about the amount of weight. It's not about overstraining and the intensity. It's in the small micro movements that we need to get better at that'll help us with the macro movements. So slow down to speed up is kind of the principle here. Because all these exercises that we will email you and we'll send you and give you a copy of so you can start working on them is going to be working more towards the left side of the screen. Ears over shoulders, shoulder over hips, hips over knees, knees over feet. And this will be the more ideal posture. YWLT exercises, many of you have seen these. And we can also give you a copy of these too if you don't have them. So just type yes if you would like a copy of these, and then we will email these ones to you. But essentially what you want to do, and you can do this from a seated position, but basically bring your arms up like a Y. I want you to lift your shoulders up, squeeze them back, and then lower them. And this is the position that you're going to hold. And then you got the W. And then you have the L, bring them down, and then you have the T. So basically with your shoulders, make sure you bring them up, bring them back, and bring them down. This puts your shoulders in proper position of doing these specific exercises here. And there is a recommendation for every 2 hours of sitting. So if you're sitting 10 hours a day, you do the quick math right here. How many times, how many rounds of these do you need to do per day? Okay, who wants to give a shout out in the chat? 10 hours of sitting, how many rounds? That's right. That would be 5 rounds of doing these exercises. If it's 8 hours that you're sitting, 4 rounds. 12 hours, 6. You get the point right there. What if they said, Doc, what if I sit 11 hours? We'll do it 5.5 rounds. Okay, just kidding. I would do 6. Okay, that would be my best recommendation for you, just to get those muscles firing the posture in a better position there. So the 3 steps to correct the cause of the problem. This is a tried and true system. This is what we teach our clients here in the office. Break the bad habits is one leg of the 3-legged stool. Second, add specific exercises in to help strengthen spinal muscles, to help your adjustments hold better postural position. And the last thing, keep your chiropractic adjustments in rhythm. So if you're currently under care and you're keeping your rhythm and you're coming in at your recommended frequency, bravo. You're going to get the best results and get the best work from the doctors here in the office by keeping your visits in rhythm. By missing 1 or 2 or several appointments can severely backslide your progress. And I know you don't want that. We don't want that for you. So staying congruent, staying compliant with your recommended frequency allows us to be able to do our best work here in the office. Look, you know, COVID for a lot of people has thrown off the rhythm for chiropractic care. We've had people coming back at various stages. So, and life can take you in a whole different direction. Whatever the reason, if you've become distracted with everything that's going on, and it's been a while since you've been into the practice and curious about, do you have any subluxations? Are there any neck or upper back issues that are contributing to your arm, upper extremity, shoulder, elbow, wrist? We invite you back into the practice. We can sit down, have a consultation, do some specific tests and an examination to find the root cause of the problem. And I'm going to invite you into the practice if you're new to this practice. So if you're a family member of one of our clients, if you're a neighbor or coworker, you're invited, however you're invited to this workshop, you found us on Facebook, Instagram, I invite you into the practice to have the new patient breakthrough experience, to see as if what is the root cause of your problem and if we can help you here. That way you can get started on this 3 steps to correct the cause, the 3-legged stool, that if you give it time, your life is going to improve and it's going to be better, and hopefully avoid any of the dangerous drugs or unnecessary surgeries out there. So how do you know if you have a subluxation? There's 5 criteria. We do instrumentation in this office to identify the stress on these individual nerves, and it's called your core score. So we can see how your body is adapting to stress. We can look at muscle tension. We can look at nerves and the flow of information to your organs, and we can also see your body's adaptability to stress. We do motion palpation and static palpation with the chiropractic evaluation. We're going to take some pictures of your posture to identify postural abnormalities, and then we're going to take some pics of the spine if necessary and required to find out if there is a subluxation so we can identify the root cause of the problem. So what should you do? If you're asking me, my recommendation is you should get checked. That's how you're going to know, and we're going to know if you have subluxation that's leading to upper extremity issues that is interfering with your quality of life. So we can get you on a plan of action to be moving your life forward towards being able to do the things that you want to do. So you don't have to work around the problem. We can get you to a point where you can enjoy life and be able to live life on your terms and not have to sacrifice the things that you enjoy and the things that you love right there. So we come in, and normally people ask me, well, Doc, all right, that sounds like it makes sense. What do I want to, how do I get checked, or how much does it cost, and what's the time involved? Simply, it's about a 45 to 60-minute process where we do initial intake. We find out what is going on, what your concerns are, the impact this is having on your life, and what specifically are your goals. What are your immediate goals? What are your short-term goals? What are your long-term goals here? And then we do our objective testing. And based on what we find on your second visit, we'll sit down and then we'll report back to you if we can help, what's wrong, how long it's going to take. People also ask the question, well, doc, 45 minutes, 60 minutes of my time, I can do that. What's the cost? Normally it's $375. But as you know, you attend these body signal workshops, you're investing the time and the energy towards your health and wellness. So whether you're a new client or you're looking to get back under care where we need to do an updated set of tests and the history and things like that, it's simply just $79. It's $79 for those that want to get checked. That applies to your family members, your friends, your coworkers, so on and so forth. And we're happy to follow up with you if that makes sense to you and that sounds like something that fits in your life and you want to follow up with. What I recommend is you reach out to Lynn. Lynn's our office manager here. Lynn at purechiropractic.com. That's LYNN at pure, P-U-R-E, chiropractic.com. We can get you scheduled for a new patient appointment or a reactivation where we can sit down and we can talk about where we left off with your health, what's new, what are your new goals, and a plan of action moving forward there for you. So in closing, remember, 87% of people over the age of 65 do have or will have some sort of rotator cuff tear. The research is there, and that can significantly impact your quality of life. So if you're in that age range or above, or you are approaching that, we can be proactive to help you wherever you're at to get your life back. They say there's 3 reasons, they did a recent study, 3 reasons why we're in such a healthcare crisis today. And number 1 is we take our health very reactively, meaning that we wait for the problem, the pain, for example, to get so bad before we take action. The second reason is that we just didn't know. We didn't have the knowledge or the information to do better. I always say is that if you know better, you're going to do better. And that's part of my job as your chiropractor is doctor means teacher. And the third reason is procrastination or lack of action. We know that we need to make changes. A wise doctor once said, the thief of health is procrastination. I invite you today, there's no better time to take care of your health than today in this moment. If you're currently a client at Pure Chiropractic, I want to say thank you for your trust that you have in our office and helping you with your health and wellness goals. If you are new to our practice, I invite you in and I appreciate the opportunity to serve you in advance. Next week, we're going to be tackling the falling apart syndrome part 2. This is going to be on lower extremity. So we're going to be talking about the pelvis, the hip, the knee, the ankle, the foot. So look out for the invite for that webinar and register for that and share it with people that you know that could benefit. If you know anybody that is a pain in the butt or has a pain in the butt, they need to be here next week. Today was all about the pain in the neck, or if you know somebody has a pain in the neck, share this information with them. Looking ahead to September, I know many of you are asking, well, what's coming up in September after the falling apart syndrome? Well, I'm very happy to report it's all about chiropractic and kids. What better time to be talking about kids, family, their health, and their goals as they're returning to school. Love and appreciate each and every one of you. Thank you so much for joining in this evening. I wish you all a great night. Have a wonderful weekend, and I'll see you next week on the webinar. Thank you so much. Have a beautiful night. Thanks for attending.